Chapter 24, the Urinary System, Part 2. So here is a nephron that's been stretched out. So renal corpuscle, glomerulus. As we know, the glomerulus and the glomerular capsule is where filtration occurs. So glomerular filtration, fluids, the water and solutes moving from the blood to the glomerular space. Solutes include nutrients, waste, electrolytes. Nothing protein size or bigger leaves, only things smaller than proteins. And that is a lot of fluid that is leaving the bloodstream during glomerular filtration. Then, at the beginning of the renal tubule, we have tubular reabsorption. Tubular reabsorption, fluids and materials leaving the nephron and returning to the bloodstream. This is primarily water with many of the solutes that the blood needs, the electrolytes, and especially the nutrients. So going from the nephron to the capillaries. And then the third process, of course, is tubular secretion. Tubular secretion occurs at the end of the nephron. This is when materials in the bloodstream and capillaries return to the nephron, secreted from the bloodstream into the nephron. This can include any remaining waste in the bloodstream, drugs, any ions and other things that are in major excess. Basically, the point being to fine-tune the blood composition and then make sure it is at the proper pH. And what this means, of course, is that urine comes directly out of our blood. So all the urine you ever excrete was in your bloodstream. Kidney disorders, renal failure. Renal failure is a decrease or cessation of glomerular filtration. What's occurring in the renal corpuscle is ceasing slowly over time. It can be acute. Acute renal failure is temporary, caused by something like low blood pressure, decreased heart output, cardiac output, maybe some minor damage, kidney stones, side effect of drugs, something acute that in theory the person is going to recover from. Chronic renal failure, however, is progressive and irreversible decline in glomerular filtration. Over time, more and more nephrons lose the ability to engage in filtration, so lose the ability to function. And this is a major problem that will lead to death if left untreated. The first route of treatment for someone suffering from chronic renal failure is dialysis. Dialysis is when someone is attached to a machine. They have their blood sent out of their body into the machine where the blood is cleansed, as it were, returned to ideal composition, and then sent back into their body. Dialysis can take many, many hours, has to be done like 3-4 times a week, is a major hassle, and is not as good as an actual kidney, so people on dialysis are suffering and have a greater chance of passing. What can happen to replace the dialysis machine is a kidney transplant, where a kidney goes from a donor and is transplanted, surgically placed into the recipient, the person who is having failing health. Now, kidney transplants are special because it is possible for the donor to be alive. So we have 2 kidneys, and it turns out we can get by with just one. So someone who is a very good match can donate a kidney and have it surgically placed into someone else. All right, leaving the kidneys, we go to the ureters. Ureters are the tubes that connect the kidneys to the urinary bladder. The ureters, as you see, have a mucosa layer lining the inside, producing some mucus. It has a muscularis layer of smooth muscle tissue, and then an outer adventitia layer where you'll find blood vessels, nerves, and so forth. The fluid, the urine, travels down the ureter via peristalsis, via muscular contractions within the ureter. And this means, of course, that you can stand on your head or any direction you want, and urine will still travel down the ureter because it's muscular contractions, not gravity, that do it. The ureters open up into the urinary bladder. actually a little below the midline of the urinary bladder. And the ureteral openings will close when the fluid pressure in the urinary bladder increases. So basically, as the urinary bladder fills with urine and begins to stretch, that is what closes these openings to prevent urine from backing up into the ureters. The urinary bladder is a muscular pouch. The urinary bladder has a mucosa layer with mucus being produced. It has a muscularis layer, and then, of course, on its outer surface is a serosa layer. The urinary bladder uses these muscles to force urine to leave when we decide to urinate. The urinary bladder has a little smooth area inside it called the trigon. The trigon has triangular in shape, 3 points. The right ureteral opening, the left ureteral opening, and the internal urethral orifice, the ureters and the urethra, are the structures that form the points of the trigon. There are also ridges and folds on the inner surface of the urinary bladder. These are called rugae, and these are there because, as we know, the urinary bladder is able to stretch. It is able to stretch as it fills with urine. The urethra is the tube that comes after the urinary bladder. Urethra has 2 sphincters, the internal urethral sphincter and a little further down the external urethral sphincter. These are all in the pelvic cavity. And urine is released from the urinary bladder when the urinary bladder contracts, increasing the pressure of the urine, forcing it through the urethra. At the same time, of course, the internal urethral sphincter and the external urethral sphincter will relax to help allow the urine to pass out. Turns out, the process of urination can also be called micturition. So you can always tell people that you have to go micturate, and they'll have no idea why you walked away. Urinary system is one of the systems that is noticeably different between male and female. Main difference is between the size of the urethra. The female's urethra is significantly shorter than the male's, since the male's has to pass through the male's penis. Another difference is that the female's urinary system is completely separate from the female's reproductive system. In the males, the urethra actually is in both the male's urinary system and in the male's reproductive system. So it both transports urine and semen. Micturition is actually controlled in the brain, in the pons of the brain. Detects when there is stress in the urinary bladder and will send signals to lead to the muscular contractions and the relaxing of the internal urethral sphincter to allow the urine to pass out. We, of course, also control micturition, also control urination. We do this by consciously controlling the external urethral sphincter. So if you ever had one of those days where you were needing to go to the bathroom and you just had to hold it, and it's waiting longer and longer and longer, and it's hurting, and then it suddenly feels like you started to urinate, but then you're clamping down hard, so nothing quite comes out, but it feels like it kind of started. That means that the pons told your urinary bladder and the internal urethral sphincter to relax. A little bit of the urine started to move down the urethra, but then your control of the external urethral sphincter stopped progress. However, you definitely need to find a bathroom quickly because you are going to lose the battle in the end. And that is it for this lecture.